To conclude the session, I would like to again invite two discussants to share their reflections on what was presented, the key lessons they take away from these presentations, and any relevant information or implications these innovations have for the wider field. First, I will invite Mr. Radu Ban. Radu leads the work on measurement and evidence for the WASH program at the Bill and Melinda Gates Foundation. In his role, he is part of the WASH Gender Working Group and leads the measurement and evidence portfolio regarding the role of gender in WASH. His words will be followed by the reflection from Gloria Lehimo. Gloria is UNICEF's WASH specialist in the regional office in South Asia. Radu, over to you.
All right, thanks, Anita. Guess at some point I need to change that profile picture because I'm look a lot younger there. Thanks for the opportunity to be a discussant this morning. I have to say I have very fond memories of our earlier engagement with Sesame Workshop on the development of the Raya character. And it's great to see that now she has, siblings and continues to be a symbol for the WASH work. So I was really following very closely Julie's paper, and actually I read it even before. I think. It's a great paper for a couple of reasons. The first one is that it puts forward this idea that the way we look at the menstrual hygiene experience should be as trying to make it as pleasant as possible, because it's a value in itself, right? We shouldn't always think of that experience as important because it may lead to other outcomes in terms of health or in terms of education, particularly when some of those links are sometimes tenuous. They're not always there in the data. But to me, the paper puts this idea that, look, we need to make this the way that the girls experience menstruation as pleasant and as possible. And it's not, at the end of the day, it's not such a unbelievable idea. I mean, the stuff that we experience every day, we don't always think of it as valuable because it leads to other outcomes. The way we think about our day-to-day lives is not always trying to increase our attendance in school or trying to avoid particular diseases. We try to make our lives good in every single step. And the fact that this paper really talks about the MH experience as a value in itself, I think it's great. The second reason why I think that this paper is great is because it really focuses on all the details of that MH experience, while also keeping that instrument fairly narrow. So it asks, in some sense, all the things that describe the experience, but in some sense, nothing more. And we've been having discussions with several of our colleagues and partners about what it takes to have a global measurement approach to MH. And one of the things that you keep running into is it tends to become a very broad topic. So you want to include questions about education, you want to include questions about health, and then it becomes this sort of not unmanageable. So the fact that Julie and her co-authors were able to start with with these 54 items and then narrow them down to something even more manageable, I think it's great. And it also it has enough detail. So this measurement tool has enough detail to really allow for identifying still what are the problematic areas in the MH experience. So we can distinguish whether the problem comes at the product level, like the girls are not satisfied with the way they interact with the product. Does the problem come from the sort of the environment they live in, that they don't have privacy? That would require a different set of interventions. Or they're not satisfied because perhaps the way others, their colleagues or adults think about menstruation, and those are yet another set of problems that require other types of interventions. So those were the two main things I liked about the paper. Like I said, it puts forward this idea that MH experience is valuable in of itself, and takes a narrow yet with enough detail approach at measurement. There were a couple of things where I, maybe these are a little bit into the detail side, but I know, Julie, you mentioned that some of the questions are sort of answered on a positive scale, where always is a good thing, and others are answered on a negative scale, where always is a bad thing. And I was curious if there was a way to see if people really understand that. Like if you were to reverse the question, would you get the reverse answer as well, to make sure that people are not just saying, okay, always is always good or something like that. But that was just a fairly specific question. And then I know you had limited time and didn't really talk through the actual findings, but I was curious if there were things in there that you think scored particularly high or particularly low, or they changed some of your existing beliefs about what the ways in which girls experience MH. So if there were any nuggets in the data that you wish you could have shared. All right, so that was the sort of the prepared part of my my talk, but happy to take on any additional questions. Thank you.
Thank you very much, Radu. I will give it straight to Gloria for her reflections on the two presentations.
Thank you very much for the opportunity to provide reflections. I hope you can hear me okay.
Yes, we can hear you.
Okay. I think one of the things that has come out very strongly in both the presentations from Johns Hopkins and from Sesame is the importance of taking a multidimensional approach to addressing menstrual hygiene issues. I think, like Julie highlighted very clearly from the menstrual practice needs scale, it highlights the need to look at menstrual experiences as part of a collective range of practices and not necessarily as a singular practice. And we know that there are varying factors that contribute to either a positive or negative menstrual experience. And we know that this experience is never linear. So we have to take this kind of considerations into perspective when we're developing our monitoring measures. And of course, this calls for a very robust sort of like measurement scale to be able to understand the broader impacts of menstrual health interventions. I mean, I think leading to that as well is that I think this concept also just builds onto what Sesame is doing on their Girl Talk program, because it also takes a very integrated approach at addressing menstrual health. I think what was really interesting about Sesame is also how their approach really combines interventions that provide the social support to girls by engaging the wider community. I mean, we've been hearing even with the comments from the chat, with people excited about hearing men being engaged and boys being engaged, which is really interesting because we know those kind of initiatives are more far-reaching and more sustainable just because of the aspect of engaging the community in these kinds of initiatives. I also like the fact that it also increases girls' confidence through the trainings that they've been doing, which are also informed by really, really robust formative research. in addition to providing access to supplies and facilities. We know that all of these are crucial ingredients for effective MHM, because we know in the sector, obviously, that successful MHM initiatives, obviously, are usually the ones that are holistic in nature. Another thing I'd want to sort of like reflect upon and put out there is the fact that we often look at the impact of MHM and work under the prism of indicators like, school attendance and also absenteeism, as well as to what extent WASH facilities create an enabling environment for MHM to thrive. But what's interesting about both of these presentations is that they've made very poignant reflections about pushing the needle further to integrate and measure more softer elements of MHM, looking at areas such as strengthening girls' self-efficacy, and also, understanding how the trainings we provide or even the skills we're trying to impart are improving girls' self-confidence, and also things like participation in class, which I think are very crucial and are often very we have a very limited capacity to measuring those kind of soft elements. So happy to hear that those can be included in these kinds of interventions, because we know also that these are vital entry points for wider gender transformative interventions, such as work on sexual reproductive health education. Another point I'd like to put out there is the issue of contextualization and how, while adapting tools like the menstrual scale, we need to develop context-specific measures that are really truly inclusive. We know that while measuring girls' experiences, we need to consider that they are not a homogeneous group. And as Julie rightly said as well, that if you were to adopt this scale, you would obviously need to contextualize it and use measures that are more specific to your context. And I think that also resonates with what Alison was saying about the sesame process that they went through to develop the animation characters, that they had to make them really resonate with the cultural context in Zimbabwe, which is really, really interesting and brings out to the fore the importance of contextualization of interventions like this. And then we know that research, especially some of the research that we've done here in South Asia, has shown us that girls' perceptions and preferences are often informed by what they consider to be aspirational because of what they've been exposed to, say, on TV, for example, and is not necessarily what they have access to. So when we're putting into consideration these factors while designing the measures, we need to have our indicators very clearly defined to be able to put this kind of factors into consideration while we're measuring and monitoring the impact of MHM interventions. So, in essence, what I'm trying to put out there or to ask is just while we're employing tools like the menstrual scale, we need to look at it as an independent scale that can be contextualized to meet the specific needs and the unique needs in the areas that we work. I'm going to end there for now. Thanks.
Thank you very much, Radu and Gloria, for your reflections on the last two presentations, but also on the wider themes that we've seen throughout the conference. So there was a big theme about multi-sectoral approach, working across the ecosystem that includes trade and supply chain, but also different members of the community, fathers, mothers, teachers, which is not always easy, and sometimes we need to take a heart and overcome some cultural barriers. Especially the second session now has highlighted the value of MHM in and of itself as a value, not just for improving other indicators. And going back to the beginning, we talked a lot about government leadership and coordination needs, including regulation, setting standards, and so on.